Hello. It's truly a wonderful Sunday to be back with you on this program. Happy New Year to all of you tuned in to our first episode of Anupale for the year 2021. I take this opportunity to extend best wishes for the new year to every Dominican. I especially wish you God's guidance and love so that your every action may be inspired with goodwill and purpose. As we embark on a new year, still inundated with the challenges brought on by a global pandemic and the ever-present threat of natural disaster, we must focus on working collectively to achieve a state of well-being for all citizens. I will need the support of every Dominican to achieve the ambitious but attainable goals we have set as a government to ensure continued prosperity for our people and country. As I've said and I've indicated before, this year we will see the commencement of several new initiatives to improve livelihoods, advance infrastructural development, and boost economic growth. We will do this on several fronts, focusing on various sectors of the economy. And so I wish to take this opportunity to impress upon the importance of a nationalistic approach and attitude to development this year. Your government is working for you. I implore every Dominican to ask yourself, how can you fit into the overall development goals of our country and become a contributing participant in nation building? I urge you to use this opportunity of a new beginning to reconsider your place in the grand scheme of this country's development. Will you be a constant source of negativity and anti-progress sentiment? Or will you join forces with those pursuing growth and opening new pathways for progress, we may ask ourselves? It is my hope that you will choose the latter option and adopt a more collaborative approach at various levels. For example, how can you better contribute to development within your own community? How can you collaborate with your village council or your parliamentary representative to identify developmental goals and work to achieve these? Can you form an organization of your own with your peers to tackle needs within your community, to uplift the lives of your less fortunate fellow Dominicans? I encourage you to consider all this as you move ahead with your personal goals. As you take responsibility for your own development and that of your country, let us work together and let us spare no effort, let us spare no thought to ensure that we can advance our country's development. We have been through a number of challenges, but that has not daunted us. Your government stands ready and is putting in place several measures to assist you in your quest for personal growth and success. In this new year 2021, I encourage a spirit of determination among all Dominicans, a posture of positivity and strength, a belief that we are indeed a resilient people and can take on the challenges of our time head on and come out stronger every time. My dear brothers and sisters, friends, on today's program, I have a very, very special guest. The director of the Pan-American Health Organization, PAHO, Dr. Carissa Etienne. Dr. Etienne joins me from Washington, D.C. for a discussion on the state of healthcare in the Americas. Dr. Etienne, as you know, is a daughter of the soil, who we are very proud of. And I dare say I am extremely personally proud of Dr. Etienne's achievements and a contribution. And it is a source of pride for me when I sit in meetings with fellow heads of governments from across the Americas, and I see her speak and present, and I hear the accolades and the respect that she receives from my fellow heads. She is the former director of primary health care in Dominica and has served as the director of Pan-American Health Organization since 2013. And she's also the regional director for the Americas of the World Health Organization. We are certainly honored to have her with us to talk about her work at the helm of PAHO during the COVID-19 pandemic and her views on the provision of healthcare in Dominica and the region. I wish to welcome Dr. Carissa Etienne, the director of the Pan American Health Organization, to our first episode of Anupali for 2021. Dr. Etienne, welcome. Dr. Etienne, welcome.
Good afternoon, Honorable Prime Minister Skerrit.
I think you have your microphone muted.
No, I think it's okay now.
Excellent.
So good afternoon, PM, and thank you for inviting me to accompany you this afternoon.
Well, Happy New Year to you. You know, someone asked me, you know, why am I dressed with a jacket and a tie? Because I'm normally casual. Either I have a guayabera or a blazer with no tie. And I said I had to get my Sunday best because I have a very important guest with me this evening. So we're happy to have you. You know, we want to commend you for your efforts thus far as the Pan American Health Organization head during this very difficult time. But how are you faring though in this very challenging period?
Thank you, but indeed it is challenging. I find it exciting too. I mean, for more than 20 years, I was the National Health Disaster Coordinator in Dominica, and emergencies and disasters always excite me, but it is challenging to lead the work of an organization with a broad organization-wide response to provide technical cooperation to a group of member states that are quite diverse with different economic and social realities, and at the same time helping them to build solidarity and with an overall effort to save lives. So it has not come without its stresses, and we've done that in a period where PAHO was undergoing some serious financial difficulties. But I would say that we've done well. Most of our member states are very happy with the work that PAHO has done with them.
Thank you very much. Now, Dr. Etienne, can you describe for us the important work you're doing at the helm of the Pan American Health Organization to manage the ongoing global pandemic in the Americas and in the Caribbean?
So let me start this response by saying early in December of 2019, I went through my to-do list for the year, and one of the things that I had left out was the renewal and the recalling of our pandemic task force. We do have a pandemic task force in PAHO, so I recalled this task force, and I asked them to, at the same time, to ensure we review the pandemic plan for headquarters and country offices. Now, this was fortuitous because on January 4th, when we received the information from WHO about the emergence of a virus with pandemic potential, we had our plan that had been reviewed, and we had begun working with our country offices to review those plans. So on January 14th, I sent a letter to all, January 14th, 2020, I sent a letter to all member states informing them about this possibility of the pandemic. And at the same time, I sent it to heads of state and to ministers of health. And at the same time, I activated my incident management system, both in headquarters, and then rapidly after that, extended it to country offices. So the work that we did early on was the development of national response plans with our countries, an assessment of their needs, particularly their health system needs, and a determination of what was their health system's capacity and what were the gaps, and entered with them, discussed the arrangements for expanding the health services capacity. And that helped them tremendously because they were better able to face the volume of cases that they had to deal with later on in the pandemic. I dispatched teams of 2 or 3 technical experts to countries for working with member states in a short period, a 3 to 4 day period, to train their health teams, to organize services for case management. And that really turned out to be extremely helpful for many countries, including Dominica. We rapidly acquired tests. By the end of February, every country in the region of the Americas had access to testing. We were the first region with this 100% access, and we shipped tests and we trained laboratories across the region. And we also distributed the PCR tests. We engaged very early in the procurement of PPSs and the personal protective equipment and shipping of those to countries. We have in our stockpile this personal protective equipment. So we were able initially to ship to countries that had immediate needs, and then through our revolving fund and our strategic fund to procure some of those supplies for countries, and also to help countries in accessing some of the other technology that they require. Of course, surveillance is a big issue. So we set up on existing platforms serious surveillance for the COVID-19 and also for other diseases to ensure that we were keeping a broad look at what was happening. And we sent hundreds of guidelines to countries and conducted webinars. So in fact, we trained, we provided information, we provided the technology, we provided the training, the capacity building to ensure that our member states were ready. We accompanied heads of states in their decision making at country level, working through all of our PAHO WHO representatives at country level. And so we think that we were very present with member states as they faced COVID-19 and continue to face this. Just to add, to help us do our work, we needed to mobilize resources. We were able to mobilize more than $263 million for our work with member states in 2020, just for COVID-19.
That's excellent. Thank you, Dr. Etienne. Now, you served as Director of Primary Healthcare in Dominica during a period when we enjoyed a sterling reputation for efficiency and quality of service. How did this experience prepare you for your current position?
Thank you. You know, that was the best time of my career, working in the organization of primary healthcare in Dominica as part of a team. And I learned many lessons, and lessons that have served me well for my continuing career development, both at PAHO and at the World Health Organization. So importantly, the whole team dynamics and the importance of leadership of teams, and learning how to work with all team members and all disciplines, but at the same time empowering them. And this is an important lesson that was learned. I also was very grounded and schooled in the fact that the Health for All principle, which was at that time the major overriding objective for primary health care, that those principles were valid, principles of equity, human rights, and solidarity. That communities needed to be engaged fully in their own health care and in the determination of their health services. So the importance of community participation and social participation. Also ensuring that the local health system was developed, that services need to be as close to people as possible, and that quality of services was important, and that we needed to invest in the first level of care. And we needed to ensure that essential health services, medicines were available close to the client, and the focus on prevention. And this helped me tremendously. And so in 2003, when PAHO had a new director, this new director was looking for an assistant director that could help her in the renewal of primary health care in the region of the Americas. And she was led to me. And certainly in PAHO, that's what I did. I from that deep conviction that I had, and that wealth of training and experience from Dominica, I led the renewal of primary health care in the Americas. And the work that I did there also got the new Director General of WHO in 2008 to ask me to come as an Assistant Director General in WHO, precisely for the renewal of primary health care at a global level. And at that time, we started and triggered off the UHC movement, Universal Health Coverage movement, which, if you remember, 2 years ago was discussed and a resolution passed at the UN General Assembly.
Yeah. Excellent. Now, because of your time spent working in healthcare in Dominica, you are in a position to comment on the transformation of Dominica's healthcare system over the last decades. What strides do you think we have made in the quality of healthcare services offered on island? And how do you recommend we continue to improve our healthcare services?
So this requires a little history. Over time, we take things for granted. But when we started with the reorganization of the healthcare services in Dominica, we didn't have health districts and doctors residents in the health districts. We didn't have family nurse practitioners. We did have public health nurses, but the division in terms of environmental health officer and public health nurse, they were not contiguous. So everybody was working. The health team was not well developed. So since then, obviously, I have seen an expansion of the health services, particularly at the hospital level. When we were implementing the primary health care approach, in a way, we had not kept up the development at the hospital level. And it is clear the expansion of health services that has happened at the hospital level, even before a new hospital. And the number of specialties that are available at the hospital, I was trying to count in my time. I think we only had about 6 specialties, but this has 6 or 7 specialties, but this has been extended significantly. The infrastructure development and expansion, increases in healthcare workers, I think, and the range of healthcare workers, different categories of healthcare workers have come on stream. It is clear that there is an increased investment in health, and there is enhanced technology, CAT scan, MRI, all of this technology, but that was not available before. And even the access to hospital services being free of cost to the elderly and under 16 years of age, we had gone through a period where all of these people had to pay for healthcare, but obviously now there are categories that have free access to healthcare services at the hospital. So what do I recommend in terms of improving our healthcare services? I think we need to pay specific attention to quality of care improvement. The whole question of patient rights and client-centeredness. And I maybe we'll talk about that later, but there need to be stronger policies, but policies that are enforced, and that across the board, we need protocols and very strong monitoring.
Excellent. Thank you very much, Dr. Etienne. I have myself spoken about the need to improve our healthcare at the primary level, to place more attention on preventative care. I think we are making strides with the construction of several new health and wellness centers across the island. But the question is, how do you think we can improve on our primary health care services in Dominica?
So let me say that primary healthcare services are not merely the dishing out of a doctor's visit, a nurse's injection, etc. True primary healthcare demands that we are in the community and working with the community. So the increasing our home visits, increasing the work that we do in our schools, increasing the health education of our communities, but also including a reorientation of some of the services that we are engaged in. And I want particularly to talk about non-communicable diseases. I mean, 70 to 80% of deaths in the Caribbean are due to chronic non-communicable diseases. And this require a certain approach, an approach that is much different from if somebody had a cold and you had to treat them, or if they had TB and you have to treatment. It requires many other disciplines being involved in managing this chronic condition. And I think also we should be beefing up on our disease surveillance. I would think that the management of primary healthcare needs to improve. We need to train at the master's level public health specialists in epidemiology, in primary healthcare, and healthcare management. In the 80s, in the early 80s in Dominica, we had public health specialists trained at the master's level, and these are the people that led the revolution in the reorganization of health services in Dominica. So I certainly would like to see us improve in terms of ensuring that we have specialist clinics, but that we have specialist centers that you can call health and well-being, but also to return to some of the basics of the understanding of the approach to primary health care, which is essential. Over.
Very important recommendations, and we have taken very detailed notes of your recommendations with a view to certainly looking at implementing some of those very important points. Now, as you know, the government will soon take to Parliament the new Hospital Management Authority Bill, all in an effort to restructure the management of our national hospitals, and with the specific aim of improving the efficiency and quality of services. Do you have any views on this new approach that the government is taking, Dr. Etienne, with the introduction of a new management structure at the hospitals level?
Certainly I do. I like to characterize it as bringing the management of the hospital into the 21st century. If I recall, we had this triumvirate with a hospital medical director, a hospital administrator, a matron, each of those reporting separately with separate reporting lines, and that certainly does not lend itself to good management, to accountability, or to efficiency. I think a CEO who has overall responsibility for the management of the hospital, with full authority for enforcing policy and the fiduciary responsibility, accountability, and human resource management, will be a better model as long as it is done properly. I can tell you from my period in the hospital, because I did spend some time in the hospital, it was extremely difficult to get the three heads to work together with a common approach and to arrive at common policies going forward, or policy recommendations going forward. So I think that I'm sure that I'm correct, that sometime either in the late 80s or the 90s, the creation of an independent hospital board was contemplated. I remember Mr. McIntyre, who was our health services coordinator at the time, developing a paper with a group of people to put forward that idea. So I do think that a hospital board is important. It should reflect necessary expertise, obviously, and the required qualifications in those who serve, so that they would be able to discharge the requisite oversight that is necessary, including the selection of the CEOs. Because I hate to say that, but I think the independence in the selection of the CEO is going to be extremely important. So I believe that with a new hospital, that these changes are absolutely critical to ensure the highest standards and quality of care and the highest efficiency. And I know that there have been many complaints about issues of quality of care at the main hospital, which must be addressed. But quality of care encompasses a numerous number of issues in terms of investments, in terms of governance, in terms of the ensuring that your secondary and tertiary care is well developed and functions well, and there is management as well, effective management at those places. It is time that we have equal standards for quality of care, irrespective to a person's ability to pay, irrespective to your status. And I think that in a well-managed health system, your staff we will need to ensure that we have adequate, well-trained, and well-managed health staff, and that we strictly enforce the policies and the protocols, and that there is full transparency. Permit me to say that at Princess Margaret Hospital, transparency is an issue, and accountability is an issue. And we cannot have high standards of quality of care unless all of these issues are taken care of. So I do feel that you are on the right track. I want to commend the government of Dominica for embarking on this new initiative. And I think if all of us work together, and this has been PAHO's recommendation for a long time, and so we look forward to also working with you to help you successfully implement your new initiative.
Dr. Etienne, I absolutely agree with you on your observations and your suggestions. Clearly, the new structure will help, but also we need to change our attitudes. And I've always held that it makes no sense that if the hospital needs certain medication, they need to get the approval of the ministry or the permanent secretary. I think that that decision should be made by the authority there, and this new structure with legislative authority. Our hope and prayer is that it will address some of the very critical observations that we've all been making for so long in Dominica. So we look forward to that. Now, at the end of 2020, you described COVID-19 as, and I quote, the most extraordinary public health event of our lifetime, end quote. And you go on to say that to control the pandemic in 2020, and I quote, won't be easy or quick, end of quote. Why do you hold this view, Dr. Etienne?
Well, this is an infection of tremendous importance for the region and globally. The things that we have observed make me wonder if we are on track to reduce transmission effectively. Obviously, the evidence is that our cases are increasing, the deaths are increasing, the hospitalizations are increasing, and that many health systems are becoming overwhelmed by the number of cases that they have to deal with. I believe that what we are seeing also is a growing tiredness among people, and with a tendency to let their guard down, to relax prevention measures. And I'm afraid, in the light of the new variant that we are seeing, that where transmission is much higher than with the previous virus, I mean, our cases are going to increase markedly. We are seeing a reluctance for social distancing, for the simple wearing of masks, and I should say proper wearing of masks. I think with economic declines, many governments felt the need to reopen and to reestablish economic activities at a time when the pandemic had not been controlled in their countries, and the just opening the entire country and reopening economic activity across the entire country was not the way to do it. It should have been done in a manner that where the infection is under control, then you reopen. So in a phased manner. I think as well that with the continuing social marginalization and the inequity that we see in the Americas, that unless we deal with this, it will be very difficult to control the transmission of the disease. And of course, the next one is the equitable access to vaccines. I mean, what we are seeing now is that the high-income countries have access to vaccines. There are 45 countries that have started immunization with COVID vaccine. Many of those are high-income countries, and no low-income country has had the vaccines to accomplish this. And despite efforts, we are still seeing the inequity. Some of our high-income countries have ordered 5 times their requirements, and they have bilateral agreements with many of the producers of vaccines. So we need to deal with this until we are able to ensure that some 70% of our people are vaccinated or have received the COVID-19 vaccine. We will have to continue to ensure the public health measures are in place and that governments take responsibility for ensuring this.
Okay. Now, according to PAHO, the COVID-19 pandemic swept through every country in the Americas in 2020, infecting more than 35 million people and causing some 850,000 deaths. The Americas, it was reported, was the most effective continent in the context of large inequalities or inequities. Why do you think the region has been particularly been so vulnerable?
So you mentioned some of them yourself. So the Americas went through and are still continuing in a triple crisis. This is how I term it as a triple crisis: a health crisis, a social crisis, an economic crisis, and for many countries, also a political crisis, because there we saw social unrest in many of the countries of particularly South America, and changes of government, changes of ministers after a few months. Part of the problem is the inequity that is so much a characteristic of this region. This is the region that is the most inequitable. This is the region where we have very high levels of poverty, where there continues to be lack of access to basic needs like food and water and safe housing, where we see overcrowding. There is no way you can social distance in a situation where there is overcrowding or you don't have facilities for water. You can't wash your hands if you have no water. And of course, also, the informal work is highly prevalent in the Americas. If you are engaged in informal work, you can't stay home. You can't lock down. You must go out to earn and you must go out to eat. And so the vast majority of informal workers are women. And so they had to go out, and of course in that situation the transmission occurs. I talked about the early reopening of economic activity and a return to normal before the health crisis was adequately controlled. And we, with PAHO, with the ECLAC, we did a study looking at the triple crisis, and the conclusion was that we cannot reopen economies until we deal with the health crisis and until we make special efforts to deal with the social inequities that are so much a part of our region. Of course, added to that is access to testing and treatment, poor public health structures, and some countries don't have a public health program, and they have weak primary healthcare services. And you know that in Dominica, that was one of the reasons for your successes. And of course, the poor investments in health across the region. Member states decided that 6% of GDP was the adequate investment for health. Many countries are 2 to 3% of GDP in terms of their investments in health. So there is insufficient investments in health, and those are the issues that need to be taken care of if we are going to emerge successfully from this pandemic.
Now, several times during the past year, you spoke about the need to maintain vigilance and to treat the virus as a present threat to health and livelihoods. Have we rounded a corner, or is there a need to maintain all protocols and safety measures in our countries?
I think you have to be extremely vigilant, particularly in light of this new variant. We need to continue some of the public health measures. We are not advocating to go back to closure of borders. That has to be carefully studied and determined. We're not advocating for complete lockdowns unless this is necessary, but that must always be held as a measure that can be taken and should be taken if it warrants it. Lockdowns are not necessarily total lockdowns. As I said, you can lock down a district, a community, etc. Also, we will have to strictly go by some public health measures. Case detection, the isolation of cases, the identifying of contracts, quarantine, and to enforce the social distancing measures. And I dare say, particularly for the Caribbean, with the resumption of tourism and the influx of visitors to our shores, we need to make sure that we have very strong programs for testing and quarantine if necessary, and for following of the visitors.
Now, Dr. Etienne, vaccines. COVID-19 vaccines, we are told, will soon be available to countries in the region. In fact, we just this past week at a CARICOM heads meeting, my colleagues and I discussed a March 21 timeline, obviously, based on availability and what's happening in the bigger countries, as you alluded to earlier. We know, however, that there is a level of reluctance and cynicism and concern among some of our citizens about taking these vaccines. What is your candid advice in respect to the vaccines? Should we take the vaccines, Dr. Etienne?
Take the vaccines by all means. I'm waiting for mine. Take the vaccines. And there are several reasons for taking the vaccines. With the emergence of mutations, because that's one of the things that happens to viruses. If there's this magnitude and level of transmission, it is easy for the viruses to mutate. With the mutations, they may well, and as we are seeing with the UK variant, they may well acquire the ability to be transmitted much easier, or to cause more serious disease. So the earlier we take the vaccine, it's the earlier that we can slow down transmission and stop the transmission of the virus, and so prevent ourselves from being infected and possible death. And some people think that they are fine because they are not old or they don't have underlying conditions. But what we are seeing is more and more young people are becoming infected. So yes, take the vaccine. Governments and other community organizations should begin and continue the education of community members so that we can fight vaccine hesitancy and we can fight a lot of the wrong impressions that people have about the vaccine. If I may, PM, can I say a little about the COVAX facility?
Sure,
because
please,
there was a lot of misunderstanding. So the reason why, the COVAX facility is a mechanism that was set up by the World Health Organization, by the Gavi, which is Global Access for Vaccine Initiative, and CEPI, which is a global disaster response agency, to buy vaccines en bloc in a pooled manner so that all countries would have access to the vaccine. Now, most of the countries of the world have invested in COVAX. COVAX made the commitment that they would be able to deliver at least 20% of vaccines to all countries and more as those became available. So COVAX is still holding on to this commitment. COVAX has a basket of 15 vaccines. As they receive emergency authorization and as they are pre-qualified and certified by WHO, we will bring those on board. PAHO is working with the COVAX facility and with UNICEF. We are the purchasing mechanisms. And so we will have access to COVAX vaccines. We know that those discussions are ongoing. We had serious negotiations with Pfizer, and the hope is that although we had said that some vaccines would be available in March, that we probably can see that advanced and to receive some vaccines earlier. But on a note of caution, you're not going to receive the full number of quantity of vaccines. And in the same thing as you can see the experience in the US and in Canada, that those vaccines are coming in batches because obviously they, as soon as the manufacturers can produce.
Well, I really want to thank PAHO and COVAX for its efforts where we are concerned in the Caribbean community. Had it not been for this facility, it would have been very difficult for us to be able to access the vaccines in a timely fashion. I want to say to you, and of course to say to my citizens, and that I, Roosevelt Skerrit, will certainly take the vaccine. And I would urge every citizen to do likewise. It will be a voluntary offering. And the intention of the government is to ensure that it can make vaccines available to all our citizens and residents. So it's important for us to take it. I will certainly be first in line if the government allow me to be first in line to take it. You know, and I am not really going to participate in all of these conspiracy theories, you know, that usually come about when we have vaccines, as we've seen many times before. Now, Dr. Etienne, you know, our time is coming up to an end very soon. What other specific advice would you give to citizens to guide their behavior and approaches to the virus?
So, the best advice is take the virus seriously. Do not let down your guard, because this virus is serious. And see, I look at programs in Dominica frequently. I follow masks in Dominica. I see people wearing masks below their chin or below their nose. If you need to wear masks, and you need to wear them properly. We need to ensure social distancing. We need to ensure that we wash hands frequently and avoid congregating. You know, my God, there will be other times to enjoy ourselves. There will be other carnivals, and there will be other SeaWorlds, and there will be other opportunities to have a good time with your friends and even your family. So this is a time when we need to continue to hunker down, where we need to continue to ensure we follow all of the advice that has been given, and be yourself vigilant, because if you see visitors coming in, some of them coming in illegal entry, you need to report to the authority, and you need to ensure that if a person is supposed to be in quarantine, that they are in quarantine. Particularly in Dominica, the experience is the cases and the positive cases that you've seen in Dominica are mainly or wholly from visitors or returning Dominicans entering the country. So be vigilant. This is your country, and these are your people, and we need to remain healthy ourselves, but we also need to ensure that others remain healthy. So keep your guard up and do what it is you know that you should be doing.
Now, what about policymakers like myself and the various officials in the Ministry of Health? What should be our priorities in managing this health challenge?
So remember, I said that this was not just a health crisis, that and the management of the health crisis also depends on what other sectors will do. So I do believe that governments should continue to ensure multi-sectoral engagement, and to continue meeting with the other sectors and engaging them in planning. Governments need to continue high vigilance and enforcement of public health measures. This is going to be important. I would think that you need to continue the investment in the health sector, and also in the social determinants of health, like adequate and safe housing. And my congratulations to the government of Dominica on the housing initiative, but also access to nutrition, water, and sanitation. Very importantly, however, I think all governments at this stage should have already re-established and strengthened essential health services, and particularly at the first level of care, because we are seeing excess mortality from non-communicable diseases, from other diseases that could be managed but had not been managed when we were dealing with in the throes of the pandemic. And importantly as well, we need to continue to ensure access to testing, vaccines, PPEs for the safety of healthcare workers, and strong vigilance.
Yeah, excellent. Thank you. Now, how is POWER continuing to support health systems in the region to maintain best practice and manage effectively?
So, of course, health services are extremely important for PAHO. One of our overriding objectives is universal health, which means universal access to health and universal health coverage. So we have very strong programs as far as that is concerned. We are working with governments to see how they can increase investments in health. We are working with IDB, with the World Bank, with ECLAC to help governments make the necessary investments. And it's important because at this time when we are seeing economic decline, it is very easy for governments to move away from investing in health, and they should actually be doing the opposite. Governments need to engage the private sector in some of its initiatives, but also to ensure good governance. And good governance speaks to policies. Good governance speaks to ensuring public health laws are followed, and that services are well delivered. And we are very, very sure, and that's how we work with member states, that if you are going to improve your health system, you need to ensure that this is based on a strong, well-financed primary health care. So we have what is called the 30-30-30 initiative, that by 2030, 30% of the investments with health will be for the first level of care, and that 30% of all barriers to accessing first level of care will be removed.
Thank you very much, Dr. Etienne. I want to really thank you for being on Anupale this time. You know, your presence is very important, you know, going through this challenge of COVID-19 and of course the possible introduction of the vaccines, among other things. Any parting words of advice to us, Dr. Etienne?
No, I probably have not sufficiently complimented Dominica on the work that it has done as far as addressing the pandemic. You have made me proud. I think you've done a tremendous job. I believe that the leadership at the highest level, the leadership at the Ministry of Health, and the healthcare workers themselves and other first-line workers are to be complimented, but also the general community. And so my congratulations to all of you. And parting words, let's keep fighting the COVID-19. It is not over yet. So do not let your guards down. Let's do the things that we know how to do best. And the public health measures that have been spoken, talked about, and that you know very well. And it's always so good to be connected to Dominica.
Thank you very much, Dr. Etienne. Of course, we want to thank you personally, and of course, PAHO, for your tremendous support, not only during the COVID period, but throughout our lifetime. I recall during Maria, after Maria, you know, PAHO was very, very instrumental in ensuring that the support was mobilized for us, and we had no reports of any diseases as a result of the natural disaster. I also want to particularly highlight and recognize Chris Stewart and Miss Wilson, who you have here in Dominica over the last several years assisting us. They're very, very helpful. And to all the PAHO team, you know, in Washington, D.C. and elsewhere, you know, you've been truly wonderful. And of course, the leadership that you have shown, the understanding of the health systems, not only in Dominica, but throughout the Americas. And as I said in my opening comments, you know, for me, it is a source of pride, it is a source of joy to see a fellow Dominican. And I have had the greatest of respect for you way back when you were in Dominica. I've had the occasion to meet with you, you know, my aunt being a primary healthcare nurse and your relationship with her. You know, I'm really, really proud of you, and it's a genuine source of pride to see how you've been able to interact with all leaders across the Americas. I wish you all the best in your family. May God continue to guide your steps and to give you the wisdom that is required, especially in this time. Thank you very much. Thank you. We'll take a short break and we'll come back for closing remarks.
Thank you so much.
The coronavirus disease may spread when people touch contaminated surfaces and then touch their face. Regular cleaning and disinfecting of surfaces that are frequent touch points helps to prevent disease spread. Every home is different, but common high-touch surfaces include door handles, tables and chairs, handrails.
Welcome back, and as I said, we've resumed our Anupale for 2021. I will be with you every Sunday from 7 p.m. To 8 p.m., where we engage ourselves on various matters relating to our country's development and issues confronting our citizens and residents and our continued engagement. It has been a wonderful program tonight with Dr. Etienne, and I'm sure we will all agree to this. I want to extend my best wishes to Mrs. Marvin James of Castle Comfort, who is not well. I pray that you will continue to improve. My dear Auntie Valda, who is in Bath Estate, I want to send my sincere regards to you. Flossie Joseph, Mrs. Flossie Joseph, Mr. Vanus John Charles, I'm hoping to come to see you, God's willing, this week. And my dear constituent, Mr. Joseph Anatol, who was not well, but who is a fighter and who was able to recover nicely, and with his son and his family, in Warner, and of course to his dear wife, very genuine and very sincere people, and I hope to come to see you at some point. I also want to extend sincere condolences to the family of Vina McDougall. I had the pleasure of meeting Vina in 1997 with Rosie Douglas first. I knew of her before, but meeting her in 1997 with Rosie Douglas, and since then, she and myself, we had a very good relationship. It's a lady who had the greatest of respect for, hardworking, who built herself, who built her own empire on hard work, and she was really a patriotic Dominican, and I wish to extend to her family my sincere condolences, and I pray that the Lord will give them the strength to deal with the loss. Also to the family of Michael Roy from Point Michel. Michael Roy is a distant family of mine, and I also want to extend to all his family in Point Michel and our condolences, and very, very sad period. And to my deceased friend who passed away, Rennie Joseph of Penville. I remember when I first contested in 2000, he was on the platform with me, speaking, and advocating the need to have me elected, and he stood with me for these 21 years, and the Lord took him to be with him, and we pray and that his soul will continue to rest in peace. And of course, to the family of Catherine Lauren and the family on the passing of your daughter. It's always difficult to bury your children. It was never meant for us to bury our children, but the Lord giveth and the Lord taketh away, and blessed be his name, and we know that the Lord will strengthen you, and we continue to pray for you and be there to support you in this very difficult time. And to my dear friend, Mrs. Teresa Jarvis and family on the passing of your husband, such a lovely man, very quiet, unassuming, but with a big heart. And I know the pain that you're going through, the relationship that you and him shared, and the closeness of it. But we're here with you, and we'll continue to pray for you, and I hope to see you soon. And we really want to extend condolences to all of you. Let us look forward to a very productive week. Ask not what your country can give to you, but what it can give to your country. This is President John F. Kennedy once said. And let us always look at our glass half full rather than half empty. Let us not focus on negatives, but look at the positive side, and to see what we can do for ourselves, for our community, for our country. Dominica needs all of us to be positive. We see what's happening in the world with COVID-19, and also insurrection in some countries. And we have to learn from these experiences, and that they do not find themselves repeated here in our country. This is a peaceful country, and we may not always agree on everything, but let us focus on the things that we agree on, and let us negotiate the things that we don't agree on to find a common understanding, a consensus. Likewise, the international airport, and hoping that next time I'll give you a full update on what we've done for the international airport thus far. God bless you. I am very happy to be back. I know I got numerous messages, when is Anupali coming back? And I am happy to be back. I will be with you every Sunday, as long as God gives me the life of a Sunday, once I'm in Dominica. And I'm even thinking about, if I'm out of Dominica, I'll get one of the ministers to come in to host the program, so that there's continuity every Sunday. God bless you. Love you very much. Thank you.
When you feel a sneeze or a cough coming, covering your mouth prevents the spread of germs. You probably knew that. But the way you cover up also matters, and that means breaking a habit you've held near and dear all your life. Cover your nose and mouth with your flexed elbow or a tissue, not your hands. Discard the used tissue immediately. Then wash your hands. Help stop the spread of germs. Remember, your health is your responsibility.
A message by the Health Promotion Unit of the Ministry of Health, Wellness and New Health Investment, Dominica.